It's time now for the legal lowdown this week. Now, did you know from July 1, significant changes are coming to the way Medicare bulk billing works in residential aged care facilities? So while the reforms are intended to improve accountability across the board, there are growing concerns that it could make it harder for some of Australia's most vulnerable people to access timely medical care. I'm glad that we are joined today by Attwood Marshall Lawyers Senior Paralegal and Accredited Aged Care Professional Bindy Marshall, because Bindy, lots are changing. Everything, it seems like, in the aged care sector changes week to week. Lots of different letterheads being sent out, and there's understandable, there's some anxiety, some worry around those changes.
Well, absolutely there are because, these are big changes that are kind of flown under the radar until about the last week. I nearly had a stroke last week when I read it. Basically what will happen is that they're going to end verbal consent for Medicare bulk billing. And from that date, practitioners, they must obtain physical or electronic signatures from a patient or a responsible person before lodging a claim, and they must retain that documentation for 2 years.
That's just going to make it all very difficult, and particularly when you think of someone who is in aged care, someone who is of that age that may not know or need to have someone with them to do that. That's time and money and a lot of heartache and, like I said, worry.
Well, let me put it to you this way. So when a GP goes into an aged care facility, some of these aged care facilities have 144 beds.
Yeah.
So they may be seeing 50 patients that day. So they may be in a couple of times a week, depending on the person's diagnosis or their current illness at the time.
Right.
So if they've got to have consent prior to that GP going in to visit, many of them are under an enduring power of attorney. So they've got to gain consent from the enduring power of attorney or from
someone
the attorney prior.
who speaks on their behalf. Yep.
Then let's add the added complexity of a joint attorney. So maybe 2 or 3 attorneys are appointed. So that's the initial consent. Then the doctor gets in there and goes, Mrs. Jones, you really need to have a CT scan and I really would like to get some blood cultures.
Yeah, true.
Well, now the item numbers have changed. So now we have more consent forms.
Exactly. No longer matches to what's needed.
So these are mega changes that are coming, and it's really going to affect aged care facilities massively.
I just don't understand how you could even possibly gain consent in that instance. A simple example like that. How can you obtain consent in a timely manner? How can you make sure that our loved ones are going to get the medical care that they need?
Well, it might be a case of you think about a GP, the facility staff know that a GP is coming the next day, and therefore they would put Mrs. Jones on that list. If she showed symptoms overnight and the nurses thought, you know what, we really need to get a GP to see her. Her breathing's becoming laboured. Something's not right there. They put her at the top of the list.
Yeah.
Well, what happens if the attorney's not available to provide consent?
That's what it's just more red tape. So why are these changes being put into place? Doesn't make any sense.
Look, they're actually good changes for the whole of the community because it keeps GPs accountable. It keeps the Medicare bulk billing from being misused, perhaps.
Okay.
So it's not bad changes, but they haven't considered our most vulnerable of vulnerable.
The practical implications of this for those people, yeah.
That's exactly right.
And if you've got a question and you'd like to join the conversation, 133 is the open line number, thanks to Watch Smoke Alarms, or you can text through as well, 0499 880 882. Bindy is a guru in this field as an accredited aged care professional, and there are so many questions in this field that, maybe we have loved ones that are moving into this space or that are already there. If they don't provide a written consent to bulk bill, what happens then? If they really do need to see a GP, are they going to get hit straight up with a full fee?
Well, what will happen, my fear is, the clinical care staff will have no option than to bundle that person into an ambulance and send them to our already overloaded hospitals.
Yeah.
Because a lot of the time you can't anticipate if that person has enough funding to be able to pay for that consultation privately.
Yeah, straight up, yeah.
So, I can see a number of factors, not just from a facility point of view, from a GP point of view, or from an attorney point of view,
Yeah.
but from a patient point of view. So you can see that there's prongs in every direction here. This is a real prickly pear.
It just boggles me that a system that's meant to be streamlined, it was the one card that was meant to help us all,
Yes.
is now becoming a more difficult process, a more painful process.
Correct.
Than
And
needs be.
I can see at the moment. So at the moment, we have a blanket authority that we sign as attorneys.
Mm-hmm.
So if we're acting on behalf of a resident, then Jeffrey Garrett, our legal practice director, would sign off on that blanket authority. The GP keeps us updated to let us know what the progress of that is, or if the older person requires additional tests. And there's really good communication between the two of them now. But what I fear is going forward, if Jeffrey Garrett isn't available at 2 a.m. when Mrs. Jones is having a medical episode, she's going to have to be bundled into the ambulance and then sent to the hospital for perhaps unnecessary tests. If it's something that they could deal with in the facility, perhaps she just needed a bit of Ventolin, or perhaps she just needed something else that wasn't already charted. But as you can see, this is a real time crisis. We're on the clock. We have till the 1st of July in a couple of weeks. So we are advocating for the Department of Health, Disability and Ageing to really respond to this quite quickly, because we don't have time to wait around. It's hard enough to get GPs into aged care facilities to consult now.
Yeah. On the text line 0499 880 882, Nathan has said, I feel this conversation is being dramatised a little. There is nothing wrong with the electronic consent for care. I'm not saying it'll be easy, but it's not as dramatic. Thank you, Nathan. The issue is that there might be someone who needs GP care that you don't want to clog up the hospital system with, that may not have capacity to consent electronically. And also the consent needs to be put in ahead of time.
Correct.
Right?
And the other
so that's
thing
the
is,
issue, Nathan.
Well, the other thing that Nathan probably hasn't considered is if you've got an attorney over and they've taken a holiday to America and they're jointly assigned with another attorney here in Australia.
Yeah, you have to wait.
Well, they have to have both lots of consent. Yeah. It's not just one. When an attorney is appointed, sometimes it's a joint attorney appointment, not a single appointment, not a sole appointment. So I think that, whilst he thinks it's being dramatised, he might want to walk a mile in the shoes of the GPs and the facility staff who are actually going to have to implement this system in the next couple of weeks.
And that's the thing too, yes. We're not being overly dramatic, but it affects everyone, not just the patients. You've got administrative staff and things. It's you want to provide the best possible care for our loved ones, for our aged and you won't be able to do that if the system is made even more difficult than is necessary.
Look, we had an episode on Friday night where we received a phone call at 9 o'clock at night to confirm that one of our attorney clients was vomiting blood. Now, let's look at this scenario. So if our legal practice director wasn't available or he had a medical episode himself and wasn't able to act, then what would have happened to this client? We ended up having to send her to hospital anyway because her needs were very, very acute. But the after-hours doctor had to go in and assess her first.
Right.
So when we're looking at this, and she needed x-rays, she needed bloods, we needed a panel of tests done. But for each of those tests that are done, there's a code, a Medicare code that has to go alongside that.
Yeah.
So you can see the complexity.
Yeah, yeah. And made unnecessarily more difficult than needs be. Australia's already experiencing shortages of GPs across the board, particularly willing to work in aged care. Could those changes make the problem worse just because it is just all too difficult, too much red tape? Couldn't be bothered to do that?
Correct. So we're already seeing the flow and effects of this now. And for someone who hasn't worked in an aged care facility or circumstance where they really have to fight to keep their GPs. When you think about a GP going into an aged care facility now and they have, say, 50 patients to see, they're on the clock from the minute they hit the ground running.
Yeah.
They're seeing those 50 patients. They're providing the clinical care updates and all the progress notes. That's 50 patients now. So then you add all of the consent forms and things. The GPs are going, this is too hard. We're just going to walk away.
Yeah.
So the phone calls that I've had over the last week, they're certainly not minimised. They are all concerned because we've had 2 GPs leave one facility already, and an emergent GP has come in to try and administer end-of-life care to a 98-year-old lady now because the GPs are gone too hard. We're out.
Oh, far out. Okay. So it's already happening even before the changes. They come into effect July 1. You have said that you've raised the concerns with the Department of Health and Aged Care. What needs to happen now to make sure that our older Australians, don't lose access to timely medical care?
Look, I think if they were to, my opinion is that if they were to review what they've just put in and made an exemption for aged care facilities or for facilities like hybrid communities offering care for their older patients who perhaps cannot sign for themselves and are relying on third parties to sign for them, if they were to get a blanket consent and it was to be renewed quarterly, I think that would be an appropriate measure. But I guess that's got to come from the powers that be.
Way higher than our pay grades, Bindy.
Right.
But I'm glad you're there advocating because this does seem like an excessive waste of time and administrative time and money. I appreciate you coming in and joining us every week. You're just a bundle of joy and you're just such a wealth of knowledge. I really appreciate it. Bindy Marshall, they're Attwood Marshall Lawyers, Senior Paralegal and Accredited Aged Care Professional. You have a great afternoon.